Hi everybody, I'm Merv, and I'm going to spend the next little while talking to you about this concept of strength as a triathlete. I should probably give a little bit of a historical background. So I grew up as a discus thrower and then as a rugby player. And so what's really interesting is being a discus thrower and then becoming a rugby player makes you the strongest rugby player on field, but you can last about 4 minutes. And in the last couple of years and several kilograms later, I've tried my hand at triathlon. And so as a physio as well, I've worked across the board, and I've worked in professional sports. I've worked in professional rugby, and I've worked in rugby in Ireland, and I've worked here, and I'm working a lot in triathlon now. And making that transition, one of the really interesting things for me over the last couple of years is I'd be speaking to athletes, we're saying, okay, you've strained your calf, or you've strained your hamstring, or you have an Achilles tendon problem. What's your training like? And they're like, well, you know, I'm trying to swim 4 to 5 times a week, and when I swim, I just try not to drown, and that's fair enough. And I get on the bike as much as I can. You know, if I can get on the bike 6 days, that's a great week. And then I do a couple of runs and a couple of short efforts and a couple of runs off the bike a week. And I'm like, okay, that's cool. When do you get? And I go, well, when do you get in the gym? They go, well, I don't. Okay. You realize we probably wouldn't have this conversation if you did. I'm like, nah, get out of town, fella. And the thing that I constantly hear is, well, like I'm a triathlete or I'm a cyclist, I'm a runner. I do that because I don't want to be in the gym. Or I don't like the gym. I've never been one of those guys. I don't wear the long vests down like this in the gym. And I'm totally okay with this, okay? I understand that, but I want to bring a bit of science to the argument as to why maybe, just maybe, you should make a bit of time for the gym, even at the cost of some other training sessions. So the first thing I want to talk about is the idea that strong is resilient. And so I've been banging on about this for a couple of years, and what's really interesting is that the tail end of last year, a bunch of guys out of Holland went and did my job for me, which is great. They went and got every high quality research study out there on prevention of injuries in athletes. And they looked specifically at the idea of what should I be doing in my exercise regime to try and help me not break. So they went out and they answered this question. When I'm exercising or when I'm going for my goal, there's a fair chance I'm going to get hurt. How do I get to my goal and not break? So they went out and they got 25 studies in the end, right? Of the top quality studies that existed out there, which amounted to 26,000 athletes and about 3,500 injuries. So all told, sample size, the numbers off of the back of this will just add up and be robust. They looked at the idea of including stretching in your exercise regime, so flexibility work. They looked at the idea of balance, core, proprioceptive stuff, whatever that is. And they looked at the idea of getting strong. So what do you reckon? Stretching reduce your injury risk? Stretching a good thing to do? Bad thing to do? Hands up anyone who stretches here as part of their regime. Okay, so here's how it is. On the back of that, it had no effect on athletes' injury susceptibility. With the caveat, of course, if you're not flexible enough to lift your leg off the ground and run, that's a problem. But spending all those hours banging away on your flexibility, 26,000 athletes, no change. So those acute injuries that Jim was talking about, the acute calf strain, the hamstring strain, the joint that just blows up and gets angry, relative risk reduction of about 70%. And those overuse injuries that Jim was talking about, so the Achilles, that grotty Achilles tendon pain, or that hamstring origin pain, or that lateral knee pain when you run, relative risk reduction of adding strength training to what you do of almost 50%. So no athlete is bulletproof. I totally get that. But if you're going to be out there repeating X revolutions a day, and then getting off and running 15Ks, and then after work squeezing in a swimming session and refueling as best you can before you put the kids to bed, knock off the sleep, wake up, get out before the sun's up again, move the numbers in your favor, get strong. Here's the bad news, though. Not quite as simple as that. Strength is temporary. So you can't go to the gym, do 50 push-ups and go, there I am, I'm stronger. And every day over 30, we get a little less strong. Sad fact for all of us with grey hair. Technically equating to a little bit more risk. The other bit of bad news is, as Jim said, the number one predictor if you're going to go pop a calf or strain a calf or have one of these acute injuries is actually if you've done it before and therefore have an underlying weakness.